With more than 1 million cases reported in one day, COVID numbers are at an all-time high. So we've got Dr. Kohli here to help us with the facts. Of course, we want to spread facts here, not fear. Hi, Dr. Kohli. Good to see you. Unfortunately, again, under these circumstances with yet another surge. What should we be doing differently to keep ourselves safe with this new contagious variant?
It's great to see you, and I'm so glad you're asking me this, because now that we have this vertical rise in cases because of Omicron, it is really time for us to start to change our behavior. And I want to explain the new rules with this variant, because we have been talking so long, 6 feet of distance and 15 minutes of contact being the definition of when you could be at risk. Guess what? That's thrown out of the window with this variant. So even just a few seconds of contact, and it can be more than 6 feet, can increase your risk. In fact, standing in an elevator with someone, for example, who coughs can increase your risk of exposure. So definitely start to think about that, be more mindful about how you're behaving around others. And the second piece of this, I want everybody to upgrade those masks. It is time to get rid of the cloth masks, and I see them everywhere, but I really want us to start wearing KN95s or surgical masks at the very least.
All right. Well, Doc, full disclosure, we spoke earlier at 10:30, and I asked you where your DBL hat was behind you, and I see it on that. It's on a candle back there. That looks like the candle retired in '86.
Actually, it's a vase. It's a vase, and I put it on there to elevate the DBL hat to the level that it deserves.
We appreciate you. Now, well, let's get down to it. Now, a lot of experts are hopeful that despite the record-breaking number of COVID cases, that we can still kind of get past this. So we usually do silver linings last. Tell us some good news right now, please.
Yeah, in a funny way, this may actually be a good thing for two reasons. One, because we're seeing that Omicron in most vaccinated and boosted people. That's not to say you can't die from Omicron, because we have seen some unvaccinated people die and end up in the hospital or ICU. But for the most part, it's looking more like a cold, with sort of your head upwards being involved, not as much lungs being affected, so less pneumonia, less ICU admissions. The second piece of this, guys, is what we saw in South Africa, which is that by having an extremely contagious but less aggressive variant, a whole bunch of people get sick a whole lot faster, but in a weird way, it crowds out all the other variants, and it actually makes everybody get to immunity a lot quicker. So it's possible that this may crowd out. We've already seen it become dominant, and most of us, if we get sick or we're vaccinated, can quickly get to herd immunity, and then we can get back to life as usual.
Wow.
All right, Doc, first of all, Happy New Year, and I want to be careful how I ask questions in the new year, okay? So I want to preface that it's January, early January, and what we know now, in your opinion, when is it safe to return back to school or back to work after testing positive for COVID? So in 6 months, people don't yell at us for the information they have there and they look back on this.
You mean information evolves?
No, definitely not. You're held to it for life.
All right, Jeff, I'm going to hold you to this for life then, okay?
All right.
So, Happy New Year to you as well. And I'm really glad you asked me this question, because I just said a few minutes ago that the rule book has changed, right, for Omicron. And so, with respect to how long we need to stay out of work, that's changed as well. So the Delta variant had a lifespan of about 10 to 14 days. And that's where we came up with that 10-day isolation period from. Now that the majority of Omicron, we feel that we can shorten that for most people to 5 days. But I will add to that I do think the CDC should add a testing requirement, because we don't yet know enough about Omicron, and we don't know if some people will stay infectious longer, because the length of the time that you're infectious depends on whether you're vaccinated or not. It depends on your underlying medical problems. There's a whole bunch of factors that go into it. So personally, I'm hoping that this afternoon the CDC adds a testing requirement for return to work after 5 days. But I know there's a test, so they have to balance all of that.
Thank you, Dr. Kohli. As always keeping it real, facts only. If you have a question you want answered by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com. Thank you, Dr. Kohli.
And thank you for the hat.
We'll be right back.
You're welcome.